The governor's announcement that the state will begin phase 1 of reopening Monday gives the green light for elective surgeries. WESH 2's Greg Fox has been talking with doctors and patients about the return of these key medical procedures.
Since March 20th, an executive order halted elective surgeries to clear hospital bed space to prepare for coronavirus, something the governor says was necessary then, but not now.
People talk about elective surgeries as if it's something like cosmetic surgery or something that doesn't need to happen. Elective in most cases just means it's elective exactly when you schedule it, but it's usually something you need to get done.
Ron DeSantis has ordered those surgeries to resume beginning on Monday.
That means doctors' offices like this one are right now scheduling patients for those surgical procedures that have been delayed at hospitals and surgical centers.
Just move her around a little bit.
Dr. Randy Schwartzberg is with Orlando Orthopaedic Center, specializing in sports-related injuries. He'll begin clearing the backlog next week.
There are a tremendous number of patients who really have been in a lot of pain, who have needed surgeries to allow them to get back to work, to get back to activities they enjoy, and get back to competitive sports.
Randy Gerber has been waiting for hip replacement surgery. He's trying to schedule with his doctor, fearing a long waiting list.
There were a lot of surgeries that had to be canceled. I wasn't even on the books when this happened. So hopefully I can get on there pretty quickly.
It could take several months for doctors in the state's 230 hospitals and 700-plus surgical centers to catch up on elective surgeries. In Seminole County, Greg Fox, WESH 2 News.
And doctors tell us that patients will likely be tested automatically for COVID-19 before their elective surgeries.